EHS Physical Therapy Chiropractic, along with
Jake over at Essential Motion Spine and Sport.
We have got some very important topic to discuss today. So there are multiple ways, entry points into the medical system, into the care system, right? So you have a problem, you've got some kind of back pain, neck pain, shoulder pain, hip, knee, doesn't matter what it is.
Yeah.
Yep. Whether you've had an injury or not, whether you just woke up with it, whether it was something that you've been dealing with for, a day or for a year, you have choices, you have options. We're going to take you through the roadmap that Jake has written out, that's laid out. This is not universal. I'm not saying this is the way everything works, but in general, with our years of experience, this is what we tend to see happen, whether you choose path A, path B, path C, all right? So start on the first one. Let's just say, Jake, that someone gets hurt, and they say that their common thought process, the way we've been trained in life for in general, they say, well, I need to go to my primary care doctor. I need to go to my family doctor who I've seen for everything else from my sniffles, colds, anything like that. That's right. That's who I should go to, correct?
Yeah. So in most cases, like, you're going to have, your injury or whatever, and you're initially going to go, or your mindset's going to say, okay, I should go see my doctor. So you're going to go to your medical doctor, your primary care provider, okay? And what we've typically heard, this is, like we said, this isn't always the case, but this is a typical scenario that we've had described to us, is you'll go to your primary care. They'll do a short, quick exam. They're only in the room with you, 5 to 7 minutes.
Yeah, that's after you've waited in the waiting room for a good 30 to 40 minutes, maybe an hour.
Right.
Yeah.
Typically, they're going to send you for imaging. They'll usually start with X-ray. They typically won't go to MRI, but X-ray is probably a little bit more common.
Mm-hmm. Even without any kind of injury. I didn't fall. I didn't pick anything. I didn't have a car accident. It just, my back hurts all of a sudden.
And that image can open up a door to a whole bunch of different things. It can be labeled as something that's not actually generating your pain. And it's an unnecessary cost for the most part in like 90+% of the time.
Yep. Because the image, especially in an X-ray, we talked about this yesterday, is very sensitive. It shows the bones very well. The white parts on the thing there, it doesn't show soft tissue very well.
Can't see ligaments, can't see tendons.
But the chance that the pain is coming from the bone is not very high.
No.
Especially if you said, I just had this, I played basketball, or I did something, all of a sudden now my back hurts, and I have a hard time bending forward and doing things. The chances you broke something or have a bone issue are very low. Very low. So it's going to show.
So that X-ray is going to come back negative.
And then it'll show,
some bony
arthritis,
changes,
things that every 40-year-old has, and that's not necessarily a problem. That's a normal finding. But now all of a sudden you're like, oh, don't you know I have arthritis in my back? I've got all these, stenosis. So next step.
Yeah. So after the imaging, the recommendation will probably be here: take these muscle relaxers and go rest.
Some kind of drug, anti-inflammatory, muscle relaxer, something like that.
So the patient will take that advice. They'll take their muscle relaxers. They'll rest. They won't do that activity that they were injured in for a period of a couple weeks, maybe
week or two.
They'll start to feel better.
They'll say to come check back.
Yep, they'll come check back in. So in that meantime, the patient will have gone back to doing their activity and notice that they're hurting again. Yep. So they're going to come back, doc. It helped for temporarily, and now I'm hurting again.
Yep.
So then at that point,
the most common thing in this stage right here is they say, don't do anything for 2 weeks. Come check back in with me. And they might be a little different, but for the most part, they're the same. They're not any. So they just wasted 2 weeks of time by just laying around doing nothing. And there was things that could have been done, and they come back and say, oh shoot, I guess that didn't work.
And then after no change there, they're either going to send you to PT and ortho.
Yep.
Okay. PT is probably more common.
So
where they'll send
up to here or up to here.
Yeah. So in our next, and this is probably one of the more expensive options when you have musculoskeletal pain.
You've got office visit here, $300+.
Imaging.
You've got imaging, $100+.
Pills.
Yep, which are usually not too much.
And then a follow-up.
And then a follow-up, another $300+.
Yeah. So in the middle route here, we have the chiro and PT. You start with the chiropractor or the physical therapist or some other conservative care provider. Okay.
Now that's important. Go back to that again.
Yeah.
You do not have to enter into the system in this path.
No, you can choose.
Like Jake said, you can start right here. You didn't do anything like, okay, I don't have a disease. I just have a mechanical pain, meaning my shoulder just started hurting. My back just started hurting. I have a hard time turning my neck and it hurts into my arm. Those are things that we deal with all the time, and the only thing for the most part that we deal with. So,
and in this case, and again, this is not the same case for all chiropractors and physical therapists. Some will do, a short exam and give you all sorts of stuff that doesn't matter. And this is just how we do things in our office.
Mm-hmm.
So we'll do typically like 45 minutes to an hour long exam with you. In that exam, we'll do all the testing necessary to rule out any red flag things. We'll do a movement assessment. We'll do orthopedic testing. We'll have you, if your golf swing hurts, we'll have you swing a golf club and try and determine what is contributing to your pain.
Yeah.
Okay.
Really need to get down to and ask a lot of questions, which is why it takes a while to figure out what you are. Like, what is causing this? Because what will happen here is, I'll say my back hurts, show me, okay, that hurts, okay, oh, you have a strain. I mean, if anything musculoskeletal is just called a sprain or a strain automatically. But we're going to help you figure out and dig deep into what category you actually fall into, like what's causing your
Joint,
pain.
muscle, referral, nerve-related pain. I mean,
and how to fix it.
Yeah.
That's the main thing. Like, we can't always tell what's causing it, but we can definitely help you find out how to fix it.
So once we're confident that we've ruled out red flags, we got a pretty good idea of what you are, we'll go through what's called like a trial of care. So we'll go through a treatment plan, right? So we'll provide some different interventions, assess how you respond to those, and then based on how you respond, we can either change it up, keep going, progress further, or regress and start a little bit slower. But we can make those changes because we're seeing the patient, multiple times within a short period of time, so we can see how those interventions are actually affecting them.
And that's important because this is in real time. There are things that are changing. You feel differently from day to day, from hour to hour. Mornings worse, afternoons better. Standing, walking, moving around a little better, sitting, lying worse. These things change. This was 2 weeks of good luck. Take some medications. Let's see how you do. You're on your own. You're still confused here. There's still uncertainty. You're not clear as to what you're supposed to be doing. This is clarity and not confusion because we're giving you specific things to work on at home and then rechecking, calling, how you doing, how's it feeling? 2 days later, come back in. Let's see how this is working out, and then we can adjust more on the fly.
Yep, absolutely. And then at the bottom here, so as the results of our treatment, the patient's either going to get better or they're going to have no change or get worse. Okay. After a period of time, most people are going to get better through conservative care, chiropractic, physical therapy. If you don't have no change after a period of time, after a treatment plan, or you get worse, well, then that tells us, hey, maybe there's something else going on. Now let's get an image, or let's go to an orthopedist or some sort of specialist and do some further testing and dive in because we've ruled out that our methods aren't going to work for them.
But the different, the numbers here are 97% good versus maybe 3% that needs something different.
That's true.
But then we've saved on this imaging. Then we can progress onto the more costly and expensive route this way.
And this is probably going to be your least expensive option for sure.
And one of the most effective, which is the crazy inverse relationship of people like, well, I don't want to come and do the work. I don't want to come to the visits, do all that because it's going to cost me a little bit of money. As opposed to, well, you can either do that and you can feel better and save some, or you can go down this route that we'll go through next, and then possibly do a $50,000, $60,000, $70,000, $100,000 surgery, and then still end up right back there again on aftercare. So
let's go through the orthopedist route, or if you go to even a neurologist, something like that, they'll probably do something
spine specialist, anything like that. They're all surgeons.
And again, not the case for all orthopedists, but this is a common scenario we've heard. The ortho will come in, they'll do a 5-minute exam, move your arm around a little bit, and say, okay, let's send you for an X-ray or an MRI.
This is definite.
Oh yeah, you're almost always.
They always do that.
So then after they get the results of that image, their options are
there's $2,000 right there.
They're either going to send you to PT, or they're going to find something to cut on. They're going to find something to do surgery on, and that may or may not be the true cause of your pain, especially in shoulder cases. You can have shoulder pain. Almost everyone automatically thinks it's a rotator cuff. And if you took an MRI of my shoulder, you're probably going to find a torn rotator cuff.
Because anybody who threw a ball overhead and is close to 40 years old, high percentage, 70-80% of those have rotator cuff tears. And no pain, but they're just there.
But we also know that 70-ish% of
67%
shoulder pain comes from the neck. So that's just one option. So after they go to PT, they're either going to improve or the PT is going to send them back to ortho. And then at that point, you can consider surgery.
But here is where we help with this process. If you've gone through this first, and let's just say it is appropriate where, okay, you're the 2 or 3%, 4% that needs something else. We can talk to that person and say, listen, we've done this. They fall into this process where more than likely they're gonna need some kind of surgical intervention, and they will do very well because then it's the right move, it's the right call, as opposed to falling through and then failing and then coming through it again. That funnel, we can help guide the decision making, right? Be that guide, be that the advocate for your care. No, you've done this. You've gone through these stages. You need now something else. Either maybe it's an injection.
Yeah.
Maybe it's a surgery. Maybe it's something else. But maybe it's a different kind of care that we don't provide. But at least we can help you get to the right place.
So a little recap here. You can start with any of these providers, okay?
Well, let's just say they go. So they go to.
Oh yeah, let's do this.
So
let's say you get surgery. You're either going to improve or there's going to be no change.
And either way,
if there's no change, you're going to come back to PT.
Even if you improve, they're going to send you afterwards for
you're going to get PT anyway for post-op.
Post rotator cuff rehab, post lumbar fusion rehab, post microdiscectomy rehab. That's all the same thing.
But you're either going to get PT or they'll do another surgery. Mm-hmm. So you can enter with any provider. Okay, we're just trying to tell you that you can start with chiropractic or physical therapy. That's the least expensive option. And if you paid attention to our little flow here, if you go to the MD or if you go to the ortho, they're probably going to kick you to PT anyway. Yeah. So you might as well just start with us.
At least to start.
Yeah. So
sometimes even your insurance will dictate that as well.
That's true.
You know, you got to go through this first. But and the bottom part there, like Jake had said, the vast majority of people, will get the result and the solution they're looking for anyway. Mm-hmm. And they've avoided all these other steps and traps and costly, possibly unneeded imaging and pain pills, anti-inflammatories, muscle relaxers, things that most people don't want anyway now.
Right. So if you do know of any good MDs or orthos that you've worked with and had a better experience than what we've described here, please tell us who they are, because we always need good providers to refer to, mm-hmm. and we love working with other providers. But if you have any questions about Chiro PT side or any of this, we'd be happy to answer any questions. And anything else you want to hit on here, Chris?
No, that was a great roadmap, and that's a good, I think, understanding of what. Because we'll do another video on this later. But what Jake had mentioned to me earlier, and it's so true. There is no standard for musculoskeletal care. You could go to 10 different providers and get 10 different answers, 10 different treatment plans, 10 different. There is no standard of care when it comes to musculoskeletal. Not like with certain disease processes, diabetes, other things like that. There's a kind of a standard.
Laid out plan.
You got to do this. When it's musculoskeletal and you have some kind of mechanical pain,
anything goes.
No standard whatsoever. So you have to, look and talk with different people, get reviews, check people out. Say, hey, have you had good results for this place? Because there's no standard on it. So we'll do another video on that.
Perfect. All right. Thanks, guys. We'll see you next time.
I have a cameraman comment.
Oh, hit us.
A cameraman comment. This might be a first here.
Yeah.
We might start this trend.
Who is that guy?
Who's the cameraman?
Who is the cameraman?
Yeah.
That's okay. Talk about the time frame for these two. Because
that's good.
Think about having to go to a doctor or the orthopedic. They might just keep bouncing around.
Yep.
Like, how long are these going to take? And
see, this one you tend to get in fairly quick because you usually have a relationship with them. You go to them all the time. Maybe a week or less. This is same day within 20, hour or at least 24 hours. No more than 48 typically, depending on where you go. Now, some places do make you wait a week or more. We do not. We'll work around and get you in that same day. That could be
time.
Months.
Yeah.
And so you have all that time to be healing and working on things appropriately. Even in this time frame of the 2 weeks of just resting, doing nothing, you could have made significant improvements in 2 weeks. But yeah, there's time frames, and just getting into those places is very true. Is that what you were wondering? Okay.
Sure is.
Yep.
Perfect.
Exactly right. Good point, cameraman.
Any more questions, cameraman?
None.
Okay.
All right. Drop us comments below, questions, and me and Jake will answer them.
Yep. Thanks.